Hi, and welcome to Open, the show that opens the Bronx and the rest of the world to you. I'm Kibin Allleyne, and today we'll update you on what's happening in and around our borough. Coming up, St. Jude's Children's Research Hospital has set out to increase awareness and education about the importance of HPV vaccination in preventing HPV-related cancers. The director of the HPV Cancer Prevention Program tells us later what you need to know about this vaccine. Why is St. Jude advocating for people to get the HPV vaccination? Then, on July 13th, the FDA approved the Opill tablet for non-prescription use to prevent pregnancy, making it the first non-prescription daily oral contraceptive for millions of people in the United States. We are joined by a Darney-Landy Fellow for ACOG to tell us what this could mean for abortion rights. How will this differ from other birth control products that need prescription use? After that, organization Narrative 4 created a cultural exchange initiative that invites students from opposite ends of the Great Divide to come together and hear one another's personal stories. The director of global programs for Narrative 4 and a student from University Heights High School shares more later on. How did students from these schools benefit from this experience? And finally, Americans are feeling the pressure of increasing drug prices. Many people are making the difficult decision to discontinue their medications altogether. The chief health officer of Optum Perks speaks on how people could save on their prescriptions. What is the impact of not comparing drug prices on the amount paid at the pharmacy? So stay tuned. All this and much more is headed your way because we're now officially open. Hello, everyone. I'm Kibin Allleyne, and today is Tuesday, August 1st. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. St. Jude Children's Research Hospital is on a mission to prevent HPV-related cancer. The hospital launched the HPV Cancer Prevention Program in 2021 to raise awareness and increase vaccination rates. The program now encourages a one-time vaccination before age 13 while educating parents and caregivers. Joining me to discuss this effort is the director of the HPV Cancer Prevention Program, Dr. Heather Brandt. Doctor, thank you so much for joining me.
Thank you so much for having me.
Now, I just want to start off, can you just explain what HPV actually is?
Sure. So HPV stands for human papillomavirus, but it's commonly just called HPV by its acronym. And HPV is incredibly common in the United States. It's so common that right now 1 in 4 people have it, and nearly everyone will get an HPV infection in their lifetime. And it's so common, but we don't know in whom it will progress to cause HPV cancers and other HPV diseases. And HPV cancers are, of course, very serious and include oropharyngeal cancers, cervical cancers, anal, vulvar, vaginal, and penile cancers. And what we know about HPV is that we can prevent it, at least prevent 90% of those HPV cancer cases with a safe, effective, and long-lasting vaccine. And so that takes the guessing away. If we're able to vaccinate children on time by their 13th birthday, they're going to get the most protection against these HPV cancers that they may develop as adults.
Now, I kind of want to expand on that. You mentioned the age. What are the benefits of receiving this vaccination? I understand as early as 9 years old, rather than later in childhood.
Yeah, so the CDC, the American Academy of Pediatrics, and the American Cancer Society all recommend HPV vaccination on time by the 13th birthday. And the routine recommendation is for ages 9 to 26, but we're really focused in on that 9 to 12-year-old age range for a couple of important reasons. The first reason is that this vaccine is preventive. So that means we want to make sure that that children receive this vaccine before they might engage in any behaviors where they could get an HPV infection. So HPV is given from one person to another person during intimate contact. And of course, we know that teenagers and into adults are going to be engaging in these types of behaviors. And so we want to catch them before they're engaging in anything that could allow them to acquire an HPV infection. The second reason is this vaccine works really well in this age group. It produces a really strong immune response. It's so strong that it provides a lifetime of protection when getting this vaccination on time by the 13th birthday. So for those two reasons, it's really important to focus on time. And I just wanted to mention, I know in the open, you were talking about the importance of this, and it is a 2-dose HPV vaccine series by the 15th birthday, and thereafter it's 3 doses. So there's an additional benefit to getting vaccinated on time. It's only 2 doses versus the 3 doses that are required for older children and into adulthood.
Now, can you tell me a little bit more about the HPV Cancer Prevention Program and its efforts?
Yeah, so the St. Jude HPV Cancer Prevention Program formally launched in March of 2021, and this was important for St. Jude. St. Jude is focused on curing catastrophic diseases that affect children. And so you might be wondering, well, why is St. Jude interested in cancers that affect adults? Well, the focus here is on cancer prevention and the fact that this vaccination is focused on children and giving them the vaccine today to prevent those HPV cancers that they may develop in adulthood. So my colleagues work really hard here at St. Jude every single day to treat children and save their lives. And parents and families come to St. Jude for information. And so this is a way that St. Jude can make investments in this space to build confidence in HPV vaccination, to promote awareness of HPV vaccination as cancer prevention, and ultimately think about the potential for reducing the suffering of people in the future as a result of preventing these HPV cancers so that people and families don't have to lose loved ones unnecessarily. And that's something here at St. Jude we know an awful lot about and really has been our mission and focus since our founding in the 1960s.
Now, as I understand that it's targeted, at least for the vaccination efforts towards children, and you explained beautifully why. Should adults look into possibly getting vaccinated as well if they, possibly didn't get it when they were a child?
I'm so glad you asked this question and are giving me an opportunity to respond. So while our program focuses on that 9 to 12-year-old on-time age group, people may still benefit. The routine recommendation is ages 9 through 26. So anyone in the age group of 9 to 26, and that includes males and females, should get vaccinated in that 9 to 26-year-old age range. For 27 to 45-year-olds, shared clinical decision making is the recommendation. And so this means talk to your healthcare provider if you're in that 27 to 45-year-old age range to find out if you may still benefit from HPV vaccination at older ages. There are certainly benefits to be had across the entire continuum from age 9 to 45. Our focus is really on the children in that 9 to 12-year-old age range for the benefits I mentioned before, getting to them before they may engage in behaviors that they could get an HPV infection. And second, their immune system response. And then I added a third one there. It's only 2 doses. A lot of people don't really like to get the shots, but get them because they're vaccines and they work really well. And so sometimes 2 doses can be a real advantage over 3.
So I just want to clarify on that. So once you get the 2 doses, is that it? Or is it something that you have to do possibly every 5 years or so?
You don't. This vaccine works so well that it produces a lifetime of protection. And so that's regardless of if you get the 2 doses. And it is 2 doses before the 15th birthday. And after the 15th birthday, it's 3 doses. It's also 3 doses for people whose immune systems are suppressed or compromised in any way. But yeah, that's it. Once you complete the series of either 2 doses or 3 doses, you are protected for your life. And the long-term studies show continued levels of protection out to up to 15 years. The vaccine's been available since 2006. And so that's going on more than 17 years now. And the long-term data show very convincingly that protection continues at levels that are going to make sure someone is not acquiring one of the types of HPV that's included in the vaccine, which means that 90% of these HPV cancers can be prevented as a result.
Thank you so much for clarifying that. Now, what are some efforts to educate families on this? I understand that education, just in regards to health, is such an important thing. So can you talk about your efforts to educate families on this?
Yes, a lot of parents and caregivers who are making these vaccination decisions for their children have questions. And these questions have been heightened as a result of the COVID-19 pandemic, where we saw rates of overall vaccination decline. And this was due in part to fewer visits to a healthcare provider for preventive vaccinations. It also could be the product of increased vaccination hesitancy or concerns about vaccines. And so one of the areas that we focus on is building confidence in vaccinations overall, and specifically for the HPV Cancer Prevention Program, building confidence in HPV vaccination. HPV vaccination is incredibly safe. More than 500 million doses have been given worldwide. It has an excellent safety profile. This vaccine's safety or side effect concerns are usually limited very much to pain and soreness at the injection site, maybe a little redness or swelling. There are no documented cases of serious adverse events attributed to HPV vaccine. So first and foremost, we know parents and caregivers want to know it's safe, and it is a very safe vaccine. Another thing that we know parents and caregivers want to know is, how well does it work? Does it really work to prevent cancer? This seems like such a long way from giving the vaccine at ages 9 to 12 to preventing a cancer that may not be developed into the 30s and 40s and even older. And we know from long-term studies in other countries, including here in the United States, that this vaccination does reduce prevalence of HPV infection and also prevents actual cases of cancer. In countries where HPV vaccination coverage is high, such as in Australia, Australia is on track to eliminate cervical cancer, which is one of the 6 types of cancers that can be prevented, to eliminate cervical cancer by 2035. So that means no more cases of cervical cancer in a country that really has really high HPV vaccination coverage. And in the United States, we don't have those high levels of vaccination coverage, probably due to a range of factors, including the education and awareness that you mentioned. Also, we need to make sure that healthcare providers are strongly recommending HPV vaccination, even when it's not required for school entry, as there are other vaccines during this age group, that it's still routinely recommended and that they strongly recommend HPV vaccination for cancer prevention. So we want to make sure that parents and caregivers know it's safe, it works really well, it provides long-lasting protection. We also want to make sure that healthcare providers are strongly recommending HPV vaccination and giving it the same recommendation or same strength of recommendation as for other vaccines that may be required for school entry.
Dr. Brandi, Dr. Brandt, thank you so much for joining us.
Thank you so much for having me.
If you would like to learn more about the St. Jude campaign, what parents need to know about the HPV vaccine, please visit their website, which you can find on your screen below. Don't go away. We'll be back with more Open right after this.
Most hiring algorithms would scream me out. Some bosses couldn't see me as a leader.
I've run this place for 20 years, but I still need to prove that I'm more than what you see on paper. I've been running code as long as I've been able to reach a keyboard.
This is what I do. It's second nature for me, coordinating 100 details at once.
It's the way my mind works. I have a very mechanical brain.
I sold them on my skills.
You gotta be so good they can't ignore you.
My magic is
Analytics and empathy. That's how I get clients. You have to have the confidence in yourself to show up and defy the odds.
I am more than who I am on paper.
I never got a college degree. And today, I'm the CEO of my own company. People want to tell me I'm one in a million, when actually I'm one of millions. Stars are all around us. It's time for them to shine.
Jason, let's go see your room.
What do you think? We kept it a little spare, so you can decorate it how you like.
Dinner! Go?
Excellent. Yeah, I saw you guys out there.
Welcome back. The FDA granted approval for the birth control tablet Opill to be sold over the counter. This marks the first daily oral contraceptive that can be used without a prescription. By approving this birth control pill, consumers now have the option to purchase this in drugstores, convenience stores, grocery stores, and online. Here to talk more about this is a Darney-Landy Fellow at the American College of Obstetricians and Gynecologists, Dr. Kristyn Brandi. Doctor, thank you so much for joining us.
Thanks for having me.
Now, can you just explain what could have possibly sparked the FDA to make these changes to birth control access?
I think just hearing it from the overwhelming amount of people that want this over-the-counter access. So from medical associations that have been advocating for change, including ACOG, the American College of Obstetricians and Gynecologists, who for over a decade have supported having this available over the counter, as well as patients. People want this to be available so that way they don't have to go through the hassle or have to fight the barriers of accessing this through the traditional healthcare system.
Now, will the sale of these products be similar to what many of us know as Plan B? And if not, how is it different?
Sure, and I think it's important for us to explain what the difference is between these medications. Generally, emergency contraception or Plan B is something that prevents pregnancy in an emergency, meaning that unprotected sex. This is a pill that is used to prevent pregnancy on a daily basis. But even though these medications are different, hopefully they'll be marketed and distributed in the same way, meaning that you can go to your local pharmacy, your local grocery store, and be able to go buy them without a prescription in front of the counter, meaning that they're on shelves. You can just pick it up.
Now, I want to expand on that. The FDA also declared that Opill is not for use as an emergency contraceptive. Can you just expand on the importance of that and just making sure people understand what they're going to get when they go to these stores?
Definitely. And I think that's a common question because I think there's a lot of confusion and misinformation around emergency contraception in general. So emergency contraception is a medication that works to stop ovulation in the moment, hopefully within 72 hours of unprotected sex. That's something that you take only once in a while, typically when you need it. Opill is what we call a standard contraception or birth control pill, meaning that it's something that you take every single day to prevent pregnancy. And they work in different ways. Emergency contraception is a higher dose that blocks ovulation from happening, while the Opill or typical contraception can prevent ovulation, but these doses are a little bit smaller. And so typically it works by creating a barrier using cervical mucus so that sperm can't enter the uterus and the fallopian tubes to fertilize an egg. So they work a little bit differently, but they are still great tools to be able to have. And you can use them in combination if you need to. For example, if you forgot a pill during your Opill regimen, and you had unprotected sex, you could use emergency contraception too. And so they're great tools for people to be able to have, and particularly be able to have over the counter when they need them.
Now, I understand that with O-pill, a lot of stories are just making a point to talk about how it's an oral contraceptive. I kind of want to go into that. How does this differ from other birth control products that need prescription use? And is this the only one that's currently, well, I don't know if it's currently in stores, but is this the only one that's going to be in stores?
So it's very similar to the pills that I prescribe my patients every day for birth control. We have a version of this that's similar, that's by prescription, called the mini pill, which is something that is a progestin-only pill that people use every day. So there's not much difference chemically between this new pill and the pills that people get by prescription. The only difference is the way you get them. Having to go through a physician's office or a provider's office can be challenging for a lot of people, particularly people that have been marginalized in healthcare. And so it's really great that people can have access to this over the counter, be able to pick it up when they need it, whenever they need to start a new method. And right now, there's not a lot of options on the shelves currently. People have access to condoms, which are barrier methods, and spermicides that can prevent pregnancy. But this will be the first hormonal contraception that will be available on the shelves.
And can you talk more about the importance of access? Because you recently just mentioned, not everyone feels comfortable possibly going to their physician. Can you just talk more about that?
Definitely. And this is a really important point when we talk about this over-the-counter access to this new birth control. One of the benefits of that is that people that otherwise wouldn't be able to access this healthcare can now get this pill. So when I think about people that are marginalized and haven't had access or have had barriers to access, I think about young people, teenagers who historically have difficulty taking time off of school, getting transportation, having to pay for this medication potentially with their parents' insurance. It creates a lot of issues around confidentiality and privacy. And so many teenagers just don't get birth control because they're worried about their parents finding out. And so having access to this over the counter will be a great option for people. It's also helpful for people that otherwise are either skeptical of the healthcare system, rightly so, because historical sexism and racism and other oppression within the healthcare system. And so people can do their own research and find out if this pill is safe for them and be able to use it. And people that otherwise have barriers to care, people that have limited insurance, that couldn't access a provider's office, people that, have to take off time of work and childcare and travel costs to get to their nearest provider's office. And so this is going to be a game changer for a lot of people that otherwise wouldn't have access to care.
Now, according to the FDA, almost half of those 6.1 million pregnancies in the U.S. each year are unintended. How will access to birth control impact the work that many health professionals like yourself are doing in the field?
Well, I think initially healthcare providers were worried because people come in for birth control, and this is an opportunity for us to talk about other preventative measures, things like HPV screening, cervical cancer screening, breast cancer screenings, in my work as a gynecologist. But I think we've thought about this differently, and we don't want people accessing birth control and creating this requirement that people have to go in person to get it to be a barrier for people to access this care. I think for people that are seeking birth control and look through their options and decide that this pill is the right option for them, they can go get it. And I don't want to create barriers or a delay in them getting that care. But I hope that they come to me to get their other types of gynecologic care when they need it. But I know that many people aren't necessarily going to choose this particular pill or want to talk about it with their provider anyway, in the range of other options for birth control. And so I don't think people are just not going to come to the doctor's office anymore. I think people will be coming out and people seeking birth control. It'll just look a little bit differently. And people that want to come in will have that option. And people that don't will also have an option.
I also want to expand on that. Does it make, I guess, things a little bit easier? If, let's say you have a patient that has maybe an unintended pregnancy, and now because they have this access to birth control, does that make things easier on the health professional's part?
I think so. And I want to stress right now that there's a lot of crises happening currently in reproductive health care. There's issues around abortion access. There's issues around maternal health care. particularly Black maternal morbidity and mortality. There's a lot of things that we need to focus on right now, and we're still recovering after COVID. And so having people be able to access birth control and limit the amount of visits that they're taking into the healthcare system so it doesn't prevent other people from getting other types of healthcare will really help the burden of people that are really crunched right now, trying to take care of as many patients as we can.
Now, you kind of briefly mentioned it, but we saw the overturning of Roe v. Wade. Will this affect how these pills are distributed across the country? Will this be considered like a highly political thing now that it should be available in stores and grocery stores? Can you just tell me your thoughts on that?
Yeah, I'm getting more and more worried about this. I think because we've seen a lot of politicization of the healthcare system and reproductive health care, it's really great right now in this post-Roe world that people are going to have more access to things that prevent pregnancy, like this new birth control pill. It doesn't fix the abortion crisis that's happening right now in many states. And I'm concerned because we saw in some of the abortion bans, in some of the preliminary versions of those bans, language around banning contraception, particularly things like emergency contraception and IUDs, because people confuse that with abortion. And so I worry that while contraception is incredibly popular and people benefit from this both emotionally, personally, and from their health perspective, I'm really worried that this issue will be politicized and potentially in the future, there may actually be bans on this pill being over the counter and other contraceptions in the future.
Now, you just said something that I think is super important, that a lot of people often confuse birth control with abortion. And obviously, it's all a part of reproductive health. But can you just expand on, why there should be an importance to understand that these are two different concepts?
Right. And I provide the spectrum of reproductive health care. And so I want to help people regardless of what they need. But it is important for people to know that contraception and abortion are different things. And when we say things like emergency contraception or using contraception to prevent pregnancy, that means that if you were to take these medications while you are pregnant, not only will it not work as an abortion, it won't end the pregnancy, but it's also safe to take in pregnancy. These are the same medications, the same hormones in very low doses that your body makes when you're pregnant at very high doses. So it's incredibly safe to take these medications. They will not cause an abortion if that is something that you're concerned about. But I do worry that all this care is really important and essential for people to access. And I worry about that politicization and the polarization of this issue, because people just really, at the end of the day, need to get the healthcare they need.
Now, because this is over-the-counter, proper use is very important. Can you quickly just inform our viewers what they should keep in mind if they are interested in this birth control?
Definitely. And it's something that I counsel my patients on the exact same way if I was giving them a prescription for birth control. So this pill is something that has to be taken every single day. It lasts in your system about 24 hours or so. And so that's why it's important that you have to take it about the same time every single day. And that if you don't take it every single day, you may have a chance of getting pregnant. And so it's important to follow the instructions if you miss a pill. And if you miss a pill, you may not be protected. And so it's important to use condoms or another backup method if you're having sex and you don't think that you're protected with your pill. Again, it's also something that doesn't protect you from sexually transmitted infections. And so it's important to use a condom or some barrier method to protect against sexually transmitted infections. And they work really well together. It'll increase your chance of preventing pregnancy if you use this pill as well as using condoms. And lastly, that this works for the vast majority of people with really few side effects. The only contraindication or reason you shouldn't take this medication is if you have active breast cancer. And so if you have any questions, you can always reach out to your local provider and ask questions and feel comfortable taking this medication. But again, I'm really glad that it's going to be available so people can be able to use it whenever they need it and be able to access contraception.
All right. Well, thank you so much for joining us. We really appreciate it.
Thanks so much for having me.
If you or someone you know may be curious about this new form of birth control and may have some unanswered questions, please go to the FDA website, which you can see on the screen below, to find out more. And if you would like to learn more about the works of the American College of Obstetricians and Gynecologists, please go to their website at www.acog.org. Stay tuned. We have more open for you right after this.
What you have achieved here today is going to help us and our futures. It is why we are coming up on stage to collect your diplomas.
You know it's true.
Mom, we love you always.
Everything I do.
When you graduate, they graduate. Visit finishyourdiploma.org to find free and supportive adult education centers near you.
Did you know dragging chains can spark a wildfire?
Only you can prevent wildfires.
Is it time yet?
It's time.
Come start time for dinner.
Oh, terrific.
Donating pet food is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Welcome back. Nonprofit organization Narrative 4 developed a cultural exchange program called the Field Exchange, bringing students from different backgrounds together to share their personal stories while building a sense of community and understanding. The initiative has been successful in the past, with students from Kentucky's Floyd Central High School and the Bronx's University Heights High School participating in the exchange. Joining me to discuss the program is a director of global programs at Narrative 4, Lee Keylock, and Obianuju, a student at University Heights High School of the program. I want to thank you both so much for joining me.
Thanks for having us.
Now, can you just tell us a little bit more about the organization Narrative 4?
Yes, we're a global organization whose mission is really just to build a community of compassionate youth through storytelling, through the exchange of stories. We think that stories are really the shortest distance between two people. We all have them. It's democratic, it's fun, and it sort of builds bridges very quickly.
Now, what is the Field Exchange experience all about?
Yeah, so the Field Exchange is an extension of our story exchange program that we run in schools across the globe, actually. And it's when we intentionally bring two sort of communities that never have an opportunity to meet together. For example, Uju's school in the University Heights and Eastern Kentucky. So you've got two completely different demographics. And yeah, we bring community together to share stories, learn about each other, and get interested.
No, I think this is super exciting. Growing up for me, I used to see this kind of stuff on TV and thought it was super cool. So how has your organization, I guess, updated the program just to make sure that, the kids in it today are actually getting what they need?
Well, I'm going to let Uju speak to that in one sec, but what we do is we flip the script a little bit. You just talked about update. How do you keep it fresh? Mm-hmm. Our methodology is really about sort of taking on somebody else's story to get closer to their experience. So if you and I were partnered, you would tell me a story from your life, I would do the same, but then you have to go back and tell my story in the first person. And we find that that's the sort of most radical difference between us and a lot of the other sort of organizations that sort of flirt with stories.
And can you just expand, what was that experience like for you?
So I'm a girl from the Bronx, a student born and raised in an urban setting. I would have never seen myself going to rural Kentucky. That's why I really love Narrative 4. It's an amazing program. It's opening up new opportunities to students like me who would have never seen themselves in these places. I really enjoyed my experience in Kentucky, being able to make new friends and being able to see a different side perspective of things other than the stereotypes that you just hear. You're able to go in hand and see it in first person.
No, I think that's amazing. When I was reading the story, I was like, wow, I'm an adult and I think I would be overwhelmed with, just this opportunity to kind of, I guess, live a different life a little bit. Can you just, explain, is this something that you would recommend to other students? Is this something that you want other, people your age to kind of experience?
100 times, yes, I would recommend this. I really am thankful for my high school, University Heights High School, for having so many opportunities available to students and showing us this opportunity, especially. At first, I didn't think this was a program for me because it was shown to us like as a storytelling program. But as you get into, you really have to be in it to truly understand the greatness it can do. And I'm very proud to be a Narrative 4 ambassador and a University Heights High School ambassador, so I can share to my peers and my underclassmen the great opportunities of this program and so much more.
Now, can you just explain what inspired the creation of this entire, just experience?
I mean, we're an artist-founded organization, so artists are always sort of breaking the rules, right? So they, we're actually 10 years old this year, and one of the questions that artists often ask themselves, at least the authors that co-founded the organization, is what is the highest aim of storytelling? And for us, this method became a way to get people interested in other communities, shatter stereotypes, break down barriers. And then you're far more likely to act sort of compassionately towards another group when you get to know them, when you collapse the distance between people. So that was really the sort of premise of Narrative 4. How do we use stories as currency to get people to walk towards each other as opposed to, sort of being divided?
And can you just talk about the success of the program? Because I understand this actually, helps students, just with graduation and, and in attendance. So can you just expand on, the success of this all?
Yeah, I think that some of the principles storytelling seems simple on the surface, but really we're building, essential leadership skills, right? So there are skills of curiosity. You get sort of, you think about how do you listen to others to understand as opposed to react? And then you generate this warmth and this generosity between each other so that you start thinking about challenges in your communities and working together and borrowing from different cultures. We're a global org, so we have students like Uju that we can Zoom them together with kids in South Africa, Mexico, Israel, all over the place. So it's really the greatest global classroom for teachers as well.
You talked about, the Great Divide and, coming together. Can you just explain, or talk more about the divide the country is experiencing? And, were you at all, I guess for both of you, were you at all nervous of like going to two very polar opposites, I guess, in the United States? Can you just expand on that a little bit more?
Well, I'll let Uju speak to the idea of nerves. We're never flippant about it. We never just throw communities together and say, hey, make it work. We understand the narratives that are out there. But most narratives are single narratives and they're incomplete stories about people and places. And when you truly sort of thrive in the stories of other people from the first person and you get their point of view and perspective, you realize we're far more similar than we are different. And youth are far more open and optimistic about those things than sometimes adults, right? We can get a little cynical sometimes. So that's why youth are at the helm in our program. But I'll let you talk to how did you feel when you went to Kentucky?
I wouldn't say I was nervous. I was actually very excited and I felt prepared because the field exchange was 2 parts. So they came to New York in November. So that was a little more nervous because like you're meeting new people, high school students your age, you don't know how to interact with them. But Narrative 4 did an amazing job of preparing us before through Zoom calls, partnering us up with like students who will be our partners and just like briefing us on the whole experience.
Okay, so just to clarify, is it like you guys switch or is it, 2 students together in one part, like in New York, and then the same 2 students go back to Kentucky?
No, like a group of students. There's like a group of students. They all came from Kentucky to New York in November. And then our group of students in New York came to Kentucky in April.
Oh, okay, that's amazing. So you had support. You weren't like completely on your own. That's amazing.
Yeah.
I was like, I would be so scared as like a New York person just to go back. But I think either way, it's still a pretty amazing experience. Now, I understand the Bronx and Kentucky high schools were possibly just one. Can you talk about some of the other experiences like around the New York and I guess around the United States that happened?
Yeah, I mean, the field exchange is sort of, it's the extension of our story exchange program, which we run all the time in schools. And we have, most of the time we can do these online as well. So we bring students together. We brought kids from Chicago and Limerick, Ireland together, kids in North Carolina, with kids in New York. I mean, honestly, Israel, right? We've had kids from, zooming in from Israel and working with students in Connecticut, for example. So it's honestly the conduit or the math between two places can be anywhere. The world is very easy to navigate now especially through Zoom.
I think that's amazing. And I also want to add that, like, when I was a kid, like, I think the most we ever had was like a pen pal, and like that was it. Like, you just write a letter to somebody. So I think it's so cool that we're just like, as we evolved and, more generations come, like, we're, doing new things to get kids really immersed in this experience. Now, could you just talk about some of the benefits students had just being a part of this program?
Well, do you want to answer that?
Narrative 4 has really helped me further my deep listening skills through story exchanges. It has broadened my curiosity, like making me question more things, But most importantly, Narrative 4 is very important for when it comes to mental health, because it gives students a space, or just not just students, it gives people a space to like vent, talk about like whatever they want to talk about. It doesn't matter. The story exchanges are a place of privacy and you don't talk about it. But I really love the mission of Narrative 4, empathy through action, making a change in the world through storytelling, because there's multiple ways to make a change, but by stories swaying the heart of people, that's just truly beautiful. And being able to talk to different people, because during one of our story exchanges, we were able to meet Narrative 4 representatives from South Africa, and they talked to me about how they're helping their community through recycling bottles. And that just I was like, wow. And it reminded me of how I also want to make a change in my community through healthcare. So it has helped me want to work on my civic engagement project more and listen to the stories of people, so that one day too, people will be like, oh, how did you make a change? And I'll be Narrative 4.
Now, what would you say to future students, and I think probably more importantly, parents who may be looking into the program or may be nervous about joining the program?
I would say you really have to step in to truly understand the greatness of this program. It can't really be summed into a few words. Oh, the great things and the great things Narrative 4 has done and continues to do. It's really just a great opportunity. It doesn't matter if you feel like you're more of an athlete or you just feel like storytelling isn't for you. Mm-hmm. Narrative 4 has something for everybody. There's something to learn, a little to learn from Narrative 4 for everyone.
Now, can you just explain what you hope to see for the future of this program?
Yeah, I mean, I hope the short answer is we want to be in every school in the world, not just the US, not just England, Ireland, where we sort of exist and thrive now. I want to see students connecting. I want to see the exchange of stories and values and perspectives, so that, you're far less likely, James Baldwin, right? He said it's much harder to hate somebody close up and you can get excited about, people, as opposed to sort of fear people. So I want to see that in every school in the world. And it's also great for teachers too, because, the teachers get to become humanized in front of their students by exchanging stories too. And the students vice versa. You get to know it makes a very big school sometimes feel much smaller and much safer and much more vibrant,
I didn't think about, the teacher's experience. So thank you so much for sharing that. I'm sure that was like a huge learning opportunity for all of you as well.
Yeah, I was a teacher for years in the public school system. So I started this in Connecticut in my classrooms. And I know that once you know something personal about all your students, and you know the story behind the sort of face that sits in front of you every day, and then, they know you too. It helps with connections. Students feel seen, validated, heard. And then other things happen because of that. Academics go up, interest goes up, in the lessons that you're sort of doing together. You learn through the stories that are being told and shared.
I'm so glad that, we had the opportunity to talk about this. As I mentioned, I wish something like this was around when I was in high school, especially, with the rise of the internet. You see so many people's experiences and you make your own assumptions about them. But to actually have that opportunity to put yourself in it, I can just imagine, what that's like and how much so many kids in the Bronx and across the United States could have benefited. So once again, I want to thank you both so much for joining us.
Thanks for having us. Yeah, it's been great.
If you or someone you know may be interested in this amazing cultural exchange program or would like to find out more information, please visit their website at www.narrative4.com. We have to take a quick break, but we'll be back with more Open right after this.
I'll see ya.
After a basketball game, a black teenage boy, Brandon, reads his texts in his family group chat. Auntie Flo, congrats on the big win. Mom, that's my baby. Brandon replies, thanks y'all. In a park, his sister Maya texts, where are we celebrating? Dad replies, home. Mom texts, I got dinner going. Auntie Flo replies, ooh, I can't wait. Then receives a FEMA flood watch text alert. She texts the family, anyone see that weather alert? We need a plan to stay safe, especially after last year. Ready has a list of resources at ready.gov/plan. In his workshop, Dad sends a photo of emergency supplies and texts, looks like we need flashlights and batteries. Leaving a store with a shopping bag, Brandon replies, I got us covered. Mom texts, I'll check in with Grandma and Papa. Maya texts, thanks Auntie, feeling good about this plan.
Got some batteries.
Auntie Flo replies, love y'all, we gotta stay safe. Later, the family.
Feel like you get tired every time I see you.
Stay connected. Plan for that.
My character, Shazam, knows all about growing up in a family full of teenage superheroes. They're bold.
Where's everyone going?
To fight crime?
Okay.
Adventurous. Shazam! There's never a dull moment. And no matter what happens, they'll always have your back. All they need is a place to grow and be themselves. And the best part is, you don't have to be a superhero to adopt a teen. Learn more about adopting a teen from foster care. Visit adoptuskids.org. You can't imagine the reward.
Throw my heart out there in the open. Trees make you feel smaller. Can't help but get lost again.
Feel the beat of nature at a park or forest near you. Find a forest and music inspired by nature at discovertheforest.org.
I know what you're thinking. I need a job.
Well, I've been there.
I've been there.
But you gotta keep going.
You just need the right skills. Find an apprenticeship.
I found a course online.
You can do this.
You will find something.
You will find something new.
Welcome back. Many people across the country are feeling the pressure of rising prescription drug costs, now worsened by inflation. As a result, patients are avoiding their medication altogether, and skipping prescriptions can lead to poor health outcomes and even higher healthcare costs in the long run. However, there may be a solution to avoiding expensive drug prices. Chief Health Officer at Optum Perks, Dr. Jenny Yu, now joins me to discuss ways you can make informed decisions about healthcare costs. Doctor, I want to thank you so much for joining us.
Thanks, Kibin, for having me on today.
Now, can you tell us about the organization Optum Perks and some of the work that your organization does?
Yep, so Optum Perks is a prescription drug savings program that is available for consumers really to understand more about drug costs and then the available discounts that are out there so that they can make informed choices before they head to the pharmacy.
Now, can you share the latest information revealed from a new survey that found Americans aren't checking prescription prices?
Yeah, and over 1,000 respondents, adults who are either filling a prescription or refilling a prescription, 61% of those folks don't actually check drug prices before they head to the pharmacy. And for even those who do, they're confused in terms of the costs and just really what available discounts are out there. So when they show up to the pharmacy, they're often experiencing that sticker shock. And as a result, 1 in 3 Americans who are of low income and in particular on a budget are skipping filling that prescription. And as you had mentioned, those can have long-term effects in terms of not taking the medications that are needed and resulting in more complications and possibly higher healthcare costs at the end of the day.
Now, I think this is so interesting because I think that myself and probably so many other people included had no idea that this was something that you could even check, that you can even see, what the prices were. Can you just talk about the impact of not comparing or looking at drug prices on the amount paid at the pharmacy?
Yeah, and I think, drug prices probably are not in the forefront of people's minds. They're certainly looking at prices of other things. And I think that's the information we want to get out there, is for people to realize that there are differences in terms of drug costs, and that varies widely across different retailers and pharmacies. And by doing a little bit of comparison shopping, using an app or a website that's part of the prescription drug savings program, you can then have an understanding of what particular medications cost what in terms of what pharmacy you're going to in your particular area based on your zip code. And having that and having those discounts available to you, if you're on multiple medications, whether you're managing diabetes or high blood pressure or the various things that require multiple medications, having that ability to save a couple bucks will add up over time.
Now, as mentioned, high prices are forcing some Americans to skip their prescriptions. Can you just talk more, about this, I guess, harsh reality that a lot of people are facing, where they have to either choose their health over, I guess, their livelihood, which is, kind of similar, but clearly, I guess, one has more of an immediate impact. So can you just talk about that?
Yeah, I mean, I think, the cost of inflation are going high, whether we're talking about eggs or milk. These are, items that you need, but you can make the decision in terms of whether I'm buying that today versus, a week later, looking at the cost. And, unfortunately with drugs, with that high cost, people are making that decision. However, those decisions then can affect just overall the effects of the drugs in terms of, knowing people who potentially are stretching out how they take medications, or, cutting it in half of a dose to kind of stretch out how long the drugs are available to them. And they're just, and these are just the unfortunately harsh reality of our times right now. And I think we want to be able to have people understand that there are discounts that are available to them, and they should utilize it, and whether they can access it themselves or have family members and caregivers help them, it's there for them. So they need to look for it.
Now, prescription drug prices can vary depending on the pharmacy. Why are the prices so different?
Yeah, and I think that just has so many different factors in terms of what contribute to it. Just like, when you compare an household item, in one particular retailer compared to another, it differs, whether it's, based on volume or sort of the buying power and the contracts. And I think that's the same thing with medications and drugs, that they can vary widely of this way. And with Optum Perks, that utilizing the sort of buying power and leveraging Optum RX, this is a consumer product that allows people to find the right information and the right discounts to them.
Now, can you talk about the prescription drug savings programs, how that helps with costs? How can people find these programs that help with, I guess, getting their medicine at the pharmacy?
Yeah, so this is a discount program that you sign up, and it's very similar to sort of promo codes of the early e-commerce days, where you're looking to find a discount code that you can use at the checkout. Similar in that way, and that there are these discounts at no cost to you, no sort of commitment, but it's just in a place where you can find the information for comparing the drugs, as well as the discounts. And by signing up, then you have sort of a full view into, the many thousands of drugs and what the costs can look like across, and what it means to, go to that pharmacy of your choice. And maybe there's a pharmacy just down the street that's a little bit cheaper in terms of that medication you're looking for. So it allows you to be able to find the information to compare prices and then realize the discounts that are available to you.
Now, I'm really interested in understanding, I guess, your perspective in this entire situation. As I mentioned, people sometimes get forced to just skip their medications altogether because of the price. How does that make work as, for healthcare professionals like yourself, maybe more of a challenge?
Yeah, and I think we're seeing the kind of the long-term effects of people who are not filling their medication when they're asked to, and when they come back with sort of the same problem or further severity or complications as a result. Then it's one of those things where you're saddened by the choices that people have to make, but you also want to make sure that you give the right information for folks. And oftentimes, people are calling their doctors' offices as well to find information about medication, and at times they're not getting that information right away, where they're already at the counter at the pharmacy. And when they realize that they have to make that choice, it's just more convenient and easier before hearing back from the physician's office than to just leave. And I think, a prescription savings program and having that information, we all carry a phone and have that convenience, and knowing the prices, I think it just helps people to make the right choices without having to sort of leave because they just aren't able to afford it.
And I think this kind of perfectly leads into my next question. Can you just talk about the work you do in health literacy? And, I think this is just more than just going to the doctor. What can people do to make sure that they're educated about their personal health?
Yeah, I think once people can feel like they can take some control of their healthcare journey, it can help them to motivate them to do the right things. Oftentimes, people find medical information to be really complex and hard to understand. And I think it's important to write medical information in a way that helps people to feel like it's relating to them and that's speaking to them, and that they can understand it so that they can take action in having that information. For me, when I was in practice, just having people to understand, and oftentimes they don't realize that the information's out there, and for them to find relatable information, whether it's managing a disease or understanding some of their symptoms or even how to navigate healthcare, it really helps them then to make the right decisions and take the right actions.
Well, Doctor, I want to thank you so much for joining us and educating our viewers about this.
Well, thank you for giving me the opportunity to.
If you are one of the many Americans affected by the rising cost of prescription drug prices and would like to find out more about this amazing program, please go to their website at www.perks.optum.com. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Files Channel 33, or watch anytime on the web at bronxnet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and with Rena Valentine on Friday. I'm Kibin Allleyne, wishing you and yours safety and wellness now and always. See you next time.